In this video, we will discuss about the lab-supported case-based surveillance for diphtheria, pertussis, and neonatal tetanus.
Diphtheria, pertussis, and neonatal tetanus are vaccine-preventable diseases. To prevent these diseases, 3 doses of pentavalent vaccine at 6 weeks, 10 weeks, and 14 weeks of age. 2 doses of DPT vaccine at 16 to 23 months and 5 to 6 years of age. 2 doses of TD vaccine at 10 years and 16 years of age, and TD vaccine during pregnancy have been recommended under routine immunization program. Diphtheria is a bacterial disease caused by exotoxin producing Corynebacterium diphtheria. It is transmitted by respiratory droplets or direct contact with respiratory secretions. Without treatment, infected person can transmit the disease from 2 to 6 weeks from onset. The incubation period of diphtheria is 2 to 5 days. The onset of respiratory diphtheria is relatively slow and is characterized by moderate fever, sore throat, and difficulty in swallowing. Grayish-white pseudomembrane over tonsil, pharynx, larynx, and/or nose is pathognomonic for diphtheria. Bull neck appearance is a sign of severe disease. Most frequent complications of diphtheria are exotoxin-induced myocarditis and neuritis. Other complications are pneumonia, otitis media, and airway obstruction. Case fatality rate from diphtheria can be up to 20%.
Let us go through the case definition of suspected diphtheria.
An illness of upper respiratory tract characterized by the laryngitis or pharyngitis or nasopharyngitis or tonsillitis and adherent membranes of tonsils, pharynx, or nose. Date of onset for diphtheria is date of onset of sore throat. Sore throat means pain or scratchy sensation in the throat that worsens with swallowing or talking. From all suspected diphtheria cases, 2 throat swabs should be collected in Amy's transport media within 4 weeks of onset of sore throat. Bacterial culture on tellurite agar medium is gold standard lab test. Toxigenicity of the strain is assessed by ELEC test and PCR. Pertussis is a bacterial disease caused by Bordetella pertussis. It is also known as whooping cough. It is highly infectious and spreads by aerosolized droplets. Untreated cases are infectious for 3 weeks following symptom onset. The incubation period of pertussis is 9 to 10 days.
The disease has 3 phases. Catarrhal phase
Lasts for 2 weeks, having runny nose, cough, mild fever, and conjunctivitis.
Paroxysmal phase
Lasts for 2 weeks, having paroxysm of cough, more at night, and cough is frequently followed by vomiting.
Convalescent phase
Lasts for 2 weeks to several months, and cough gradually subsides. Most common complication is secondary bacterial pneumonia that may lead to death. Seizures, encephalopathy, and pressure effects of severe paroxysm can be other complications.
Let us go through the case definition of suspected pertussis.
A suspected case is a person of any age with a cough lasting 2 weeks or more and with at least one of the following symptoms. Paroxysms, that is, fits of coughing. Inspiratory whooping, post-tussive vomiting, apnea in infants, or clinician suspicion of pertussis. Date of onset for pertussis is date of onset of cough. From all suspected pertussis cases, 2 nasopharyngeal swabs should be collected in Amy's transport media with charcoal or Regan low transport media within 4 weeks of onset of cough for culture and PCR. From all suspected pertussis cases, a serum sample should be collected within 12 weeks of onset of cough.
Neonatal tetanus
Neonatal tetanus is a bacterial disease caused by Clostridium tetani. It occurs when unclean instruments are used to cut the umbilical cord or when contaminated material is used to cover the umbilical stump. In most cases, neonatal tetanus starts 3 to 14 days after birth. In neonatal tetanus, generalized spasms are commonly preceded by inability to suck or feed and excessive crying. The disease has high mortality rate despite intensive care.
Signs and symptoms include
Initially increased tone of facial muscles, inability to suck, stiffness in the neck, shoulder, and back muscles. Subsequent involvement of other muscles produce rigid abdomen and stiff proximal limb muscle. These spasms occur repetitively and may be spontaneous or provoked by even the slightest stimuli.
Let us go through the case definition of neonatal tetanus.
Any neonate who could suck and cry normally during the first 2 days of life and who, between 3rd and 28 days of age, cannot suck normally and becomes stiff or has convulsions, spasms, or both, or any neonate who died of an unknown cause during the first month of life. Date of onset for neonatal tetanus is date of onset of inability to suck.
There is no diagnostic laboratory test for tetanus. The diagnosis is entirely clinical.
Cases of diphtheria, pertussis, and neonatal tetanus, which have onset within the last 3 months, should be immediately reported to District Immunization Officer or Surveillance Medical Officer of WHO NPSP by phone call, WhatsApp, email, SMS. Name, age, sex, symptoms, date of disease onset, address and mobile number of patients should be shared. Immediate notification of cases is essential because important activities including immediate case investigation, sample collection, active searches for additional cases in the community, and immunization activities should be ensured without delay. All the cases must be investigated using case investigation form by DIO or surveillance nodal officers within 48 hours of case notification.
DPT surveillance help us to identify areas with low immunization coverage and to take appropriate public health measures.